An isotonic open kinetic chain exercise for elbow flexion includes bicep curls. Bicep curls with a supinated forearm target the biceps brachii muscle. The concentric motion for this exercise is when the weight is brought up to the shoulder, and the eccentric motion is when the weight is brought back down to the hips. Hammer curls work the brachioradialis muscle. The patient position for each of these exercises can be sitting or standing with their back erect and their shoulders back. Some common cues include making sure that you're going through the full range of motion, make sure you're standing up straight, and don't use too heavy of a weight. A patient can complete 2 to 3 sets of 10 of each of these exercises. Pronated curls with a pronated forearm target the brachialis muscle. To progress or regress from any of these exercises, the weight or resistance can be increased or decreased.
An exercise for elbow flexion is an inverted row. It is an isotonic closed kinetic chain exercise involving the biceps brachii. The concentric contraction takes place when the athlete pulls their body up to the bar, and the eccentric contraction is when they lower their body back down.
For our isometric elbow flexion exercise, you have the athlete or the patient holding a bicep curl. As you can see, we have an ankle weight placed just distal to the elbow joint, and the patient would hold this position. This exercise can be performed in a various number of ways, one of which being pictured in the video where the patient holds their palm upward. This would target the biceps brachii muscles. With your thumb upwards, that would target the brachioradialis, and with the palm downwards, that would target the brachialis muscle. This exercise occurs in the sagittal plane, and again, it is an isometric exercise, meaning there's no concentric or eccentric portion of this. Some cues to tell your patient would be to stabilize their arm, shoulder, and tighten their core. You can have your patient hold for 30 seconds and perform 3 reps of 30-second hold. So this would be a progression of the previous exercise, and pretty much what happened here is the manipulation of the moment arm causing a more forceful contraction of the biceps as well as the other muscles involved. Again, we have another progression of this exercise, however this time with a handheld weight. For this weight, you would probably want to instruct your patient to hold for a shorter duration of time, being that the contraction is more forceful with more weight.
Triceps extensions is an isotonic open kinetic chain exercise targeting the tricep muscle. The concentric contraction is the lifting phase of the weight overhead, and the eccentric contraction is the lowering of the weight back down.
Push-ups are a closed kinetic chain isotonic exercise working elbow extension. The plane of motion for this exercise is the sagittal plane. The patient should begin with their feet away from the table, their hands on the table, and their body remaining straight the entire time. The concentric motion of this exercise is pushing the body away from the table, and the eccentric is when the body is coming down towards the table. Some common cues include keep your body straight and make sure you're pushing through your elbows to get away from the table. A patient can perform 2 to 3 sets of 10 of this exercise. If a patient is ready to progress, they can complete the tricep push-ups from the floor. If a patient is having difficulty or is not strong enough to complete these on the table, they can move to the tricep push-ups on the wall.
So for our isotonic elbow extension functional exercise, I chose to do or use a resistance band hooked up to the wall. This exercise resembles the D1 PNF pattern of the shoulder, starting in flexion and ending in extension. It targets the triceps, pectoralis, and deltoid muscles. The concentric contraction portion of this exercise would be when you're bringing the resistance band closer to the wall, and the eccentric contraction would be when you are moving away from the wall. The plane of motion for this exercise would be in the oblique plane. Some common cues you would want to instruct your patient to do would be to tighten your core and try to stabilize your shoulder. And you can also perform about 10 to 15 reps and 3 sets of 15 reps.
Band pull downs are an isotonic functional exercise to work elbow flexion. This exercise targets all 3 elbow flexors, biceps brachii, brachialis, and brachioradialis, along with shoulder extensors as well. The patient will be seated on the floor, sitting up straight. The concentric motion of this exercise is pulling the band down towards the body. The eccentric motion is releasing the band back up. To progress or regress this exercise, the resistance of the band can be increased or decreased.